Hi, today we're going to talk about dementia and the brain. This presentation is not a comprehensive one of everything about the brain or even everything that might be related to a dementia diagnosis. We would all, including me, have a huge headache, born of confusion if I attempted to do that. The goal today, though, is to provide you with some understandable information, and I hope easy to follow information on changes in the brain that occur when someone has dementia and how those changes relate to what you see on a day-to-day basis. Let's start by talking about dementia. Dementia is an umbrella term used to describe a group of symptoms that affect cognitive skills or how well our brain works. Many people think of dementia as being the same thing as Alzheimer's, but Alzheimer's is not a word that should be used interchangeably with dementia. So when we think about this definition, let's talk about the fact that it is a description of symptoms. In and of itself, dementia is not a diagnosis. So what then are cognitive skills? Cognitive skills we talk about a lot. We throw the word cognitive around a lot, but often don't stop to think about exactly what it means. Here's some cognitive skills. They involve such things as thinking, remembering, finding words to express our thoughts and understanding what other people say to us, reading, following directions, getting started on a task. And that doesn't mean deciding that I'm going to clean the bathroom now instead of tomorrow. What that means is something as simple as being able to start eating a meal once you sit down at the table. Controlling impulses, which might include the impulse to say something inappropriate in front of someone or to even hit someone if you're angry. Analyzing, which is breaking down problems into smaller parts and involves looking for relationships and patterns in information. Planning, which involves sequencing information. Problem solving, which combines analyzing and planning and takes them a step further, using past experience in similar situations to figure out what to do now in this situation. It may involve looking at previous situations and picking out the commonalities, and also involves identifying obstacles and how to overcome them. Decision-making. Decision-making involves a careful evaluation of alternatives and then taking an action. Using good judgment includes such things as knowing what clothing is appropriate for the weather or whether I can buy that really expensive item given my financial status and resources, and adapting to new situations. Adapting to new situations uses many of the skills that we've already talked about because we are using information and previous experience to determine how we can change. Impairment in any of these cognitive skills will result in changes in what we do and in what we say. Although all of these changes may not occur together and their appearance may vary by individual and by type of dementia, loss of impulse control, immediate memory and recall, appropriately interpreting and comprehending language, abstract thought, higher order problem-solving skills, and mental flexibility are all hallmarks of early dementia. Okay, what else do we know about dementia? It affects memory, thinking, and social abilities severely enough to affect our relationships with others and to interfere with daily life. When we talk about daily life, we generally can divide those activities into two categories, and these are referred to broadly as activities of daily living or instrumental activities of daily living. I'm going to talk briefly about these because you will frequently hear these terms used when you may be getting help from a professional, or if you have to fill out insurance papers. They're terms that you'll come across in your journey with your loved one with dementia. Activities of daily living include such things as bathing, dressing, grooming, toileting, and transferring from chair to chair or bed to chair. These are primarily self-care activities. Instrumental activities of daily living are a little broader in scope and include the ability to manage finances, drive, or to navigate public transportation if that's what you typically use, the ability to use the telephone, to manage medication, to do housework, and basic home management. There are at least 50 different kinds of dementia. This number varies depending on the source, and I've seen it range anywhere from 10 to over 100 kinds of dementia. Regardless of the exact number used, the fact that there are so many kinds of dementia is a surprise for most people, as is the fact that some dementia-like symptoms are reversible. Dementia, as we usually think of it most often, is a symptom of a neurodegenerative disease. The term neurodegenerative means that there's a deterioration in the function of at least one part of the neurological system. In this case, it's the brain. Dementias that fall into this category include Alzheimer's, Lewy body dementia, frontal temporal dementia, and vascular dementia. While most dementias at least eventually include some degree of memory loss by itself doesn't mean a person has dementia. And remember, in Lewy body dementia, memory loss may come much later in the dementia process. Other physical conditions that may cause or mimic dementia include such things as depression, brain tumors, head injuries, nutritional deficiencies, hydrocephalus, infections, drug reactions, and thyroid problems. These are treated differently from dementia, and some can be fully resolved. That's why it's so important to have a complete medical workup before a diagnosis of a type of neurodegenerative disease is made. We want to make sure that we aren't looking at symptoms of something that is reversible. Okay, let's look now at the most common kinds of neurodegenerative dementias. The most common kind we think now is Alzheimer's disease, and it accounts for probably 60 to 70% of all dementias. Vascular dementia, which is the result of strokes in the brain, and these strokes may be silent, or they may be obvious strokes. Strokes are created when there's an obstruction of a blood vessel in the brain so that blood flow is cut off to a part of the brain, or when there's a hemorrhage in a part of the brain, and the combination of the interruption of blood flow and the blood itself on the brain creates death of cells. We can see vascular dementia typically on imaging studies, and what we're finding is that in many people, they have a condition called multi-infarct dementia, where there's multiple small areas of the brain that have been affected by blood flow being cut off, and they may never have had any symptoms of a stroke. Lewy body dementia, or dementia with Lewy bodies, accounts for 10 to 25% of dementias, and may be higher as we are getting more and more adept at diagnosing Lewy body dementia. Frontal temporal dementia, again, accounts for about 10 to 15% of all dementias. And then there's this entity called mixed dementias. Many people who have dementia have more than one kind of dementia going on, which is one of the reasons that you get confusion in what symptoms are occurring sometimes and what the prognosis and the most appropriate approach might be for an individual. The most common kinds of mixed dementia are Alzheimer's and vascular dementia, but there can be a combination of two or all of these dementias that go on at the same time. One of the newer types of dementia that we're seeing, and we really don't have any statistics for yet, is called COVID dementia. There's a question as to whether COVID infection precipitates a manifestation of dementia in a person that was already going to have dementia, or causes dementia in an individual who had no other factors that would have predisposed them to this diagnosis. It's too early to know exactly what's going to happen and how frequent COVID dementia is going to show up, because we just haven't had enough time from the pandemic to be able to track people. Most of the people that we're seeing now with COVID dementia are people who had COVID in the early days of the pandemic, had severe COVID, and at a time when treatments and certainly immunizations were not available to help ameliorate exposure to the virus. The symptoms of COVID dementia seem at this point in time to be similar to that of Alzheimer's dementia. I've already said that a thorough workup is needed to determine whether the difficulties a person is having are a type of dementia or the result of some treatable medical condition that presents with some of the symptoms typically associated with the dementia diagnosis. The other reason that a thorough workup is necessary is that various types of dementia start with different symptoms, progress differently, and have somewhat different treatments. We'll talk more about this in later classes that we will be having. So saying someone has dementia is like saying a person has cancer. Until we know what type or types of dementia we're talking about, we really have no idea what we might expect, and more importantly, how to best treat any symptoms. Having said all of that, I am going to use the term dementia in the rest of this presentation, as much of what we will talk about is common to all the kinds of dementia that we will be addressing. Teepa Snow is an occupational therapist who is internationally known for her work in dementia care. She's been at that for about 40 years and has quite a track record for approaching dementia care in the most positive light possible. She says this about dementias, that they all have four things in common. There are at least two parts of the brain that are dying. They're progressive. They're not curable or fixable, and they're terminal. Okay, now that we've talked about dementia itself and what that term means, we need to talk about the structure and chemistry of the brain and what happens in both of those areas when a person has dementia. So just to remind you how important the brain is, we're going to start out with some general facts about the brain. We take a lot of what the brain does for granted in our day-to-day life. So this is just a reminder. The brain is one of the largest and most complex organs in the body. It's the command center for the nervous system, and it's responsible for all thought and movement that the body produces. The adult brain weighs between 3 and 4 pounds, and it receives 20 to 25% of blood from the body with each heartbeat. That percentage helps you understand why having a stroke, when the blood supply to the brain or an area of the brain is interrupted, can result in such catastrophic changes in a person. The brain consumes as much as 20% of oxygen and glucose that's taken in by the body. When we're thinking intensely, it may use up to 50%. Wonder if that could ever be used as a weight loss common as a weight loss measure for some people. Don't think so. The brain is made up of more than 100 billion nerves that communicate in trillions of connections called synapses. The human brain consists of 3 major parts. The first part that we'll talk about is the brainstem. The brainstem is only about 1/2 inch in diameter, and it controls all of the basic activities of the central nervous system that occur without our having to think about them. Things like consciousness, blood pressure, breathing, heart rate, temperature, wake and sleep cycles, digestion, coughing, vomiting, and swallowing. Lewy body dementia affects many of these functions that are regulated by the brainstem well before memory problems appear. All of the motor control for the body also flows through the brainstem, and this motor control is affected in both Lewy body dementia and in strokes. The cerebellum. The cerebellum is a little bit larger, makes up about approximately 10% of brain volume. It controls posture, coordination, and balance, and complex motor actions such as walking, writing, and speech. Damage to the cerebellum causes uncoordinated movement, tremors, muscle spasms, and slow and slurred speech. The cerebellum can be affected by strokes, multiple sclerosis, or alcohol abuse. The cerebrum is the largest part of the brain. It makes up about 3/4 of the brain and accounts for approximately 85% of brain weight. The pictures of the brain that we typically see show a lot of what looks like cracks and raised areas or a bunch of noodles stuck together. All of these raised areas and crevices serve to increase the volume of the brain tissue while ensuring that it still fits within the skull. If we didn't have those cracks and crevices and raised areas, and the brain were flat, but we still had the same volume, our head would be so big that we'd never be able to pick it up. The cerebrum is responsible for higher brain functions like in interpreting touch, vision, and hearing and speech. It plays a role in consciousness, memory, reasoning, language, and social skills. The outer portion of the cerebrum is called the cerebral cortex. The cortex is where most of the sophisticated intellectual thought processes take place. It contains 2 types of tissue. Gray matter is on the surface of the cerebrum, and it's where most of the information processing in the brain takes place. It allows us to control movements, retain memories, and regulate our emotions, among other things. Gray matter is decreased ultimately in all types of dementia. A rapid or significant decrease in gray matter may in fact be predictive of more rapid progress of a dementia. White matter is deeper in the cerebrum and connects the regions of the cerebrum to each other and the cerebrum to other parts of the brain. Damage to white matter slows down the transfer of nerve impulses. This decreases information processing and attention, among other things. Like gray matter, white matter is also decreased in all kinds of dementia, but is particularly affected in vascular dementia. The cerebrum is divided into 2 halves that are called hemispheres. And as you can see from this picture, the left and right hemisphere seem to be mirror copies of each other. And they are generally duplicates of each other, but all the functions are not the same. The left hemisphere controls speech, comprehension, arithmetic, and writing. The right hemisphere controls awareness of where things are around us, creativity, artistic, and musical skills. Thus, the description you hear sometimes of people either being left brain or right brain, with right brain being the more artistic kind of personality. The right side of the brain controls the left side of the body and vice versa. Therefore, damage to one side of the brain affects the opposite side of the body, and we see this happen most frequently in individuals who've had a stroke. Let's look a little more in depth at the cerebrum, since so much of what we see every day is somehow related to this part of the brain. The cerebrum is made up of 4 lobes with unique functions, as well as some overlapping functions. This, I think, is one of the best graphics I've seen for the relationship between area of the brain and function of that area. The brain stem is listed, along with those things that we've already talked about as the responsibilities of the brain stem, and the cerebellum. So let's talk about those lobes of the cerebrum, the 4 lobes that the cerebrum is divided into. The first lobe we'll talk about is the frontal lobe. It's located behind the forehead at the front of the brain and is responsible, as you can see from the list, for initiation, problem solving, judgment, inhibition of behavior, planning and anticipation, self-monitoring, motor planning, personality and emotions, awareness of our abilities or the limitations to those abilities, organization, attention and concentration, mental flexibility, and for speaking or expressive language. On top of the head, just behind the frontal lobe, is the parietal lobe. The parietal lobe is responsible for our sense of touch, for helping us differentiate between size, shape, and color of objects, for both spatial and visual perception, and for reading abilities. In the back of the head, in the area that's green on this slide, is the occipital lobe. The occipital lobe functions mainly in working with our eyes so that we have vision, and has also affected in those people with color blindness. Over our ears is a lobe of the brain called the temporal lobe. The temporal lobe is one of the places where the right and left sides are different. In general, the temporal lobe is responsible for some of memory, hearing, understanding language, and organization and sequencing. But there's a part of the temporal lobe that is preserved in individuals with dementia. And that part of the temporal lobe is located only on the right side. We don't know why this area is preserved in dementia. We just know that it is. That's the area of the temporal lobe that the skill that is preserved in that area, one of the skills, is music and rhythm. And we all have seen YouTube videos of a person who couldn't talk, didn't speak at all, but could sing along with a song appropriately in tune and with appropriate words. That ability comes out of the right temporal lobe. There are some other things that are stored in that right temporal lobe that are also preserved. Another one of the things is social chit-chat. This is the ability to greet people, to say, hello, how's your family doing? How's the weather? It's been a nice day. Those things that we all talk about on a surface level with other people on a regular basis. If you listen to someone who is adept at social chit-chat, though, you will realize after a while that they're not saying more than those surface kinds of things to other people. The other things that are preserved in the right temporal lobe are not as helpful as the music ability and the social chit-chat. They include such things as racial slurs, curse words, and sex talk. Knowing that may help you understand why someone who has dementia may begin to use four-letter words that they would otherwise even have been too embarrassed to think. Which lobe or part of the brain that is affected first by dementia determines which symptoms appear first. Just as the name implies, frontotemporal dementia affects both the frontal and temporal lobes, although it may start in either of these lobes. I put this slide in to make a point about area of the brain and what we also know about more refined location of skills than just knowing that they're in the temporal lobe or the frontal lobe. In this picture, in the pink, you see an area in the front of the frontal lobe that's the prefrontal cortex, and that area is responsible for planning, emotion, and judgment, among other things. You also see an area in the frontal lobe that's black in this and has the arrow pointing to it and says anticipation and verbs, and it's called Broca's area. Broca's area is typically located only on the dominant side of the brain. And what that means is that for people who are left-handed, it's on the right side of the brain. And for most of us who are right-handed, it's on the left side of the brain. It is one of the main language centers of the brain. And it's also associated with speech production and written language and with processing language. So for most people, a stroke on the right side of the brain will result in weakness on the left side of the brain or paralysis, but will disproportionately affect speech production. Knowing that some of these functions exist only in small areas of the brain or only on one side of the brain helps us understand why loss of brain tissue that is not symmetrical may result in loss of skills, that there are no other portions of the brain that are available to take care of. We need to also talk about the limbic system as we talk about the brain. The limbic system is located deep in that temporal lobe. It links the brainstem and the cerebral hemisphere. And it includes a couple of structures that we'll hear about regularly as you read about dementia or hear about dementia. And that's the amygdala, which helps the brain process emotions and attach emotional meaning to memories. It also helps the brain to form fear-based memories. The amygdala perceives threats, helps us get our needs met, and seeks pleasure. The hippocampus is another area in the limbic system, and it plays an important role in memory, learning, and storage and retrieval of long-term information. It helps to form sensory memories, such as when smelling an apple or feeling a warm sunshine brings back a memory of being at the beach or of a summer long ago. The limbic system is part of our fight or flight mechanism. It's part of the primitive brain, and its major function has been to preserve our life when we were in danger. So as the limbic system and those components of it fail, people do more frequently resort to behaviors that look like they're unnecessary in our current world, where the threats of getting eaten by a tiger are certainly much lower than they were for men thousands of years ago. Damage to the limbic system is common in most forms of dementia. It may change the way a person feels or how they would normally react to things. A person may feel more excited, anxious, sad, or apathetic. Again, some of that is that fight or flight mechanism than they did before they developed dementia. It can also lead a person to have delusions, which is a strong belief in things that aren't true. For example, believing a stranger's in the house or that someone is stealing from them. So we've talked about brain structure. Let's take a minute to talk about how messages travel in the brain. This is a picture of cell in the brain. Neurons are the brain cells, are the nerve cells in the brain, and they carry messages from one cell to another. The glial cells, which are represented in this picture in purple and pink, are cells that are supporting cells for the neurons. There's several different types of glial cells, but one type acts as scavengers to clean up debris, toxins, and metabolites from dead and injured cells. They remove excess proteins that are thought to be linked to Alzheimer's disease. The glial cells do much of their work at night during sleep. Think about what that means when sleep's disrupted, and sleep disruption is common in many kinds of dementia. If you also look at this graphic before we go on to the next slide, you will see an area between the yellow kind of corally looking shaped places on the right that's called a synapse. We're going to talk a little bit more about synapses. As nerve messages go down nerve cells, the nerve cells are not attached to each other physically. There's a space between them that's called a synapse. And the information that the nerve cell is carrying is transferred across the synapse to the next nerve cell by chemical substances called neurotransmitters. Acetylcholine is one of the brain's natural neurotransmitters. It plays a critical role in the formation of memories, verbal and logical reasoning, and the ability to concentrate. Acetylcholine excites cells, activates muscles, and supports wakefulness. It may also offer some protective benefits and may limit the neurological decay associated with some degenerative diseases. We see decreased levels of acetylcholine in all of the neurodegenerative dementias. So once acetylcholine goes into the synapse and carries that message across, remember that it's excitatory to the nerves and muscles. We've got to do something to get rid of that acetylcholine till it's needed again. If not, we would have nerve cells firing all over our body all the time, and we sure would be a mess. Acetylcholine is removed from the synapse by a chemical called acetylcholinesterase. And if you see the word erase on the end of that, that gives you some idea about what it does. It literally clears the acetylcholine out of the synapse and makes way for the next messages. Some research suggests that the plaque seen in Alzheimer's disease may increase the activity of acetylcholinesterase and consequently further decrease the ability of acetylcholine. As brain cells are damaged or killed by dementia, less acetylcholine is produced. In addition, the death of brain cells that occurs in dementia causes the brain to shrink overall. Brain cells die and the size of the brain decreases. However, that decrease is not symmetrical, and it's not just a shrinking of the brain. If you look at this slide, there's a comparison of a healthy brain with a brain with advanced Alzheimer's. For someone who has advanced Alzheimer's, and this is where we've got most of the slides that are available for us to use. This happens, again, this change in size of the brain happens in all dementias. But a person with advanced Alzheimer's brain size is about a third of that of a normal adult. The brain, as I said, though, doesn't shrink symmetrically. If you look on the right side of this slide, you will see a comparison of a cross section of the brain, which is kind of chopping down through the brain from the top, and the normal part of the brain in that cross section, and the Alzheimer's part. If you look at the Alzheimer's part, you will see that the loss of cells is not as simple as the brain shrinking but maintaining its integrity. The loss of cells results in holes in various areas, which mean those areas may be more impacted than other areas. Just as a side note, the shrinkage of the brain is one of the reasons that falls are much more catastrophic for a person with dementia. The skull helps protect our brain, and the brain fits fairly snugly in a normal individual inside the skull. As the brain shrinks, any fall means that the brain can bounce around more within the skull and have damage from the skull. And that bouncing that might not would have occurred if the brain were a normal size. Okay, so we have cells that are damaged and dying, and cells consequently that are producing less acetylcholine so that it's not available in that synapse. So the acetylcholine, where there's less of it, it also has to travel further from one nerve cell to another across that synapse. This results in a more catastrophic interruption to the transmission of messages than would occur if only the acetylcholine were reduced or the brain size were reduced some. As we talk about neurotransmitters, such as acetylcholine, there are a number of those that are in the brain, but I want to look at just a few in a little more detail and tie that to medications that are used for the treatment of dementia. Again, we've talked about acetylcholine, that it plays a critical part in the formation of memories, verbal and logical reasoning, and the ability to concentrate, that it excites cells and activates muscles and supports wakefulness. Medications called cholinesterase inhibitors are frequently prescribed in dementia. Remember that cholinesterase is that chemical that erases acetylcholine from the synapses so that the nerve cell's ready to function again. So an acetylcholinesterase inhibitor slows down that breakdown process because it inhibits acetylcholinesterase from doing its usual job. Cholinesterase inhibitors are the first line of treatment for many types of dementia. You'll know them by such names as donepezil or Aricept, galantamine, orazidine, and rivastigmine or Exelon. Another of the neurotransmitters that we see affected in dementia is dopamine. Dopamine plays a part in how we perceive pleasure and in movement. It also plays a part in motivation to learn and to meet new people. While the decrease in dopamine happens in all dementias, decreased dopamine production is a hallmark of Parkinson's disease. Levodopa is used to increase the production of dopamine, and venlafaxine or Effexor, which is a antidepressant at higher doses, can also increase the amount of dopamine in the body. Glutamate is another neurotransmitter. It plays a role in learning and forming memory. It also excites cells, and it's present in about 90% of the synapses. Too much glutamate, however, can kill neurons. Glutamate is replaced in the brain through the use of memantine or Namenda when people have dementia. Serotonin is sometimes called the happy chemical. It contributes to happiness and our sense of well-being. And and is, from that perspective, a chemical that obviously, as all others, is really important in quality of life. Decrease in serotonin can be successfully treated to some degree by the use of selective serotonin reuptake inhibitors. That's a classification of medications that's also used to treat depression. And examples of those are escitalopram or Lexapro, sertraline or Zoloft, and citalopram or Celexa. GABA is another neurochemical. It inhibits activity of neurons in an effort to decrease stress and anxiety. So it's kind of the opposite of those neurochemicals that excite the nerves. It's used for nerve pain and for treatment of seizures. It's actually also available as a supplement and not just by prescription. But we really don't have a lot of evidence because supplements are not well controlled about the exact dosage that one might get of GABA in a supplement, or that it actually reaches the brain. Gabapentin or Neurontin is one of those drugs that's used specifically for nerve pain and can increase the GABA that's available. Benzodiazepines, which are a class of drugs that have diazepam or Valium, Klonopin, Xanax, Ativan, can also increase GABA, but they are generally contraindicated in individuals with dementia. And that's particularly true in individuals who have Lewy body dementia. So, one of the most important things to understand from today is that dementia, regardless of the specific kind, disrupts both the structure of the brain and the chemicals within the brain. And those changes eventually lead not just to memory loss and other symptoms that we've talked about, but to brain failure. According to Dr. Jude Poirier, who's a specialist in aging, the state of the brain in someone with Alzheimer's type dementia is comparable to that of the brain of a healthy person whose brain has aged normally, but that person has lived to be 150 to 160 years old. That's quite a difference in what we would expect if we think about how much our brain changes from the time we are younger until we get older, and the change in skills. Think about being twice the age or more that many of our older adults are, and maybe your person living with dementia is, and what that decrease would mean in that individual at that kind of age. I hope this has helped you understand some of what happens in dementia. And I guess the most important thing is to understand that when a person has a disease that's affecting so much of their brain function, they simply are going to act different and have different skills from what they have prior to that disease. And they can't help it. The changes in the brain keep them from being able to control things that happen otherwise. So try to be patient with your person with dementia. Think about the changes in their brain, and that's really what the enemy is here, not the person themselves. Thank you.